Don't let health insurance break your family budget. Starting a family is one of life's greatest rewards, but protecting them with health insurance can be insanely expensive. According to the Kaiser Foundation, last year, the cost to add your family to an individual employee group health insurance was over $1,200 a month. The combined monthly premium for the family was $1,850 a month. Am I the only one that's thinking, wow, with that kind of cash, a family could pay for a lot of health care and a couple of nice vacations too? Hi, my name is Art Getz with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about health, healthcare, and health benefits that can make your life better. Some large employers do offer to help with the cost of adding your family to the coverage, but sadly most don't. This leaves employees with an uncomfortable decision. Is the risk really that great? Is the coverage really worth the premiums? Some large employers do offer to help with the cost of adding your family to the coverage, but sadly most don't. This leaves employees with an uncomfortable decision. Is the risk really that great? Is the coverage really worth the premiums? Unfortunately, most employees just don't have that kind of extra cash laying around once the monthly household bills are paid. It's really not that easy to face up to the reality that you just can't afford health insurance coverage for your family. It's pretty embarrassing when you love your family and you want to provide the best life has to offer to them. And while high quality health care is near the top of the list, unfortunately other priorities like utilities and food and rent, they just have to come before health insurance. To make matters even worse, using your employer's contribution to pay for your own health benefits and leaving your family without can feel super risky. This forces some families to cut back in other areas of the family budget just to pay for health insurance. One of the newest ways that families are saving real money is by actually changing the way they pay for their routine, everyday healthcare needs. Instead of taking chances on the unknown costs of going to the doctor or the urgent care throughout the year, they're signing up for primary care memberships instead. It's a little known thing called direct primary care, and each patient gets assigned a dedicated care team. It usually consists of a doctor, a mid-level provider like a nurse practitioner, and a medical assistant in case a regular member just needs a prescription refill or something quick like that. Each medical team has a limited number of patients to care for throughout the year, and by replacing fee-for-service headaches with regular monthly memberships, it more perfectly aligns doctors and their patients around health instead of money. Check out episode 11 on our channel to see more about what direct primary care is like. Direct primary care memberships will often use virtual medicine, which is actually one of the few silver linings to come from the pandemic. Before the shutdown, people only trusted virtual providers for things like prescription care. People would actually turn their nose up at the idea of a virtual doctor visit, and of course insurance refused to pay for it. Wonder why? We all learned real quickly during the shutdown that virtual medicine can be so much faster and easier than in-person care. There's no long scheduling delays, as most visits are on the same or next day. There's no drive time or gas cost to worry about, and no sick waiting area to sit in. Just unlimited doctor visits, anytime, anywhere, for a low monthly membership fee. What's not to love about virtual primary care? It can easily provide for the vast majority of most people's everyday healthcare needs. It can also help members in coordinating and accessing higher level care or managing ongoing chronic needs. If you're looking for a cost-effective way to replace health insurance and keep your family healthy, then this is it. Once you have addressed all your family's primary care needs, the only thing missing is a better way to pay for expensive, higher level care needs that might come up throughout the year. And that is exactly where medical cost sharing shines above almost any health insurance plan. Medical cost sharing really performs the same basic function as health insurance does, only without the profit motives. They both collect up regular amounts of money from a whole bunch of people who expect them to use that money to pay their medical bills, according to some rules that everyone agrees to in advance during enrollment. But with medical cost sharing, there's no army of MBAs figuring out how to make more money off of people's sickness using tools like network restrictions and care limitations. It's not like that at all, because medical cost sharing members are part of a non-profit community with member guidelines that apply equally to every member and to the payment of their high-dollar medical bills. They simply replace antiquated network restrictions with pre-negotiating the medical bills with any provider that a member chooses to see. The promise of paying doctors with quick cash almost always results in the lowest possible pricing with no compromise in the quality of care. These two things together make medical cost-sharing memberships substantially less expensive than traditional health insurance premiums, and instead of sacrificing your quality of life just to try and pay to add your family to your employer's high-deductible health insurance, more families are choosing this new layered approach to providing for their family's healthcare needs. There's no reason to stress when your family has unlimited primary care and a way to pay for expensive, unexpected health care. So go ahead and accept your employer's offer to pay for your employee-only traditional health insurance, but protect your family by enrolling them in this new combination of medical cost sharing and direct primary care memberships. We want to hear from you, so please leave your comments and your thoughts in the comments section below. To make sure you enjoy more videos like this, please subscribe to this channel, click on the notification bell, and we'll be bringing you more health benefit news and stories. And don't forget to hit the like button and share this video with your colleagues and friends because they have a health insurance problem too.